In celebration of Gynecologic Cancer Awareness Month, we are here today with Dr. Stephanie Blank, a professor of obstetrics, gynecology, and reproductive science at the Icahn School of Medicine. She is a gynecologic oncologist, a member of the Blavatnik Family Women's Health Research Institute, an expert in ovarian, uterine, and cervical cancer care. She'll be discussing gynecologic oncology. Thank you for being here with us today, Dr. Blank. Let's get started.
Great.
What are the ways people can get screened for gynecological cancer? What are the recommendations for the frequency of the screenings?
So, great question. So, when we talk about GYN cancers, we talk mostly about ovarian, endometrial, and cervical cancers. I mean, there are more, but these are the ones we'll talk about now. Cervical cancer is, has the quintessential screening test associated with it. The Pap smear, which everyone has heard of, is really an effective screening test. And that's really one of the best screening tests that there is for cancer, and that's by far the best screening test that we have for gynecologic cancer. What a Pap smear is basically we use a little brush to take some cells off of the cervix, and we put that in a little bit of fixative, and then it's looked at under a microscope, and based on how those cells look, it can give an idea as to whether there are further abnormalities on the cervix. We also do HPV testing, human papillomavirus testing, along with that. And that's a very effective screening. There's really no good screening for either ovarian or endometrial cancer. So endometrial cancer has a hallmark symptom, which is abnormal bleeding. So generally what we do is we work people up when they have that symptom. Only in certain situations where somebody has a really high risk of endometrial cancer because of, say, a family history, then we will do a screening, and that may consist of ultrasound, or it may consist of a biopsy of the lining of the uterus. Ovarian cancer finding screening for ovarian cancer is sort of like the holy grail, because ovarian cancer, we know, when it's picked up when it's early, people do well. Most of the time now it's picked up when it's late, and there is no hallmark symptom or thing for people to necessarily do. There have been a number of large studies looking at some blood tests and ultrasounds as the main things for ovarian cancer screening, and nothing has really knocked our socks off as yet. At this point in time, although there are some studies that are promising, that are still going to have more follow-up, at this point in time there's no standard screening for ovarian cancer.
What are some symptoms women should watch out for?
In terms of gynecologic cancer, there are the main symptoms that I would think about would be abnormal bleeding, and that can be abnormal in time, abnormal in amount, or bleeding after menopause. Those are sort of the main ones. Feeling bloated, feeling like you're full earlier than usual, having abnormal discharge, or pelvic pain. Now, a lot of these things people have all the time. Another symptom would be urinary abnormalities. But people have these all the time. It's really if you have a sort of a vague abdominal symptom that doesn't go away after a 2-week period of time or gets worse, that's when somebody should take that pretty seriously.
What are some risk factors for ovarian cancer, uterine cancer, and cervical cancer?
Okay, so risk factors for ovarian cancer, we don't know that much about them. I mean, the biggest risk factors include age, and we know a lot about people that have genetic predisposition to ovarian cancer. Those two are sort of the biggest ones. Not having had any children is also a risk factor. And something, in fact, having many children is preventative against ovarian cancer. For uterine cancer, the risk factors, a big one is obesity. Getting a lot of estrogen without progesterone, be that by taking a medication that might cause it, or by having, say, polycystic ovaries that make a lot more estrogen than progesterone. Taking unopposed estrogen, hypertension, diabetes. There's also family syndromes that make you more at risk for endometrial cancer. And then cervical cancer has sort of a different set of risk factors because it's caused generally by HPV. So basically having a history of human papillomavirus, having a history of any STD, smoking, having a lot of sexual partners, being immunocompromised. Those are some risk factors for cervical cancer. I'm a gynecologic oncologist, and in this field, we really specialize in the treatment of women with gynecologic cancer. So we see them at all points in time. We see people who might be at increased risk for cancer for a genetic reason, say, and we so we see them even before they have cancer. We talk to them potentially about prevention if there are options for that. When women have a mass or they're not sure what's going on, we see them at time of diagnosis. We see them at the time when they're trying to figure out what the treatment is. We do their surgery, we can do their chemotherapy or additional treatments, and we can really coordinate their care. And the really nice thing about GYN oncology is that we have just these few diseases that we know really, really well. And so we follow patients for a really long time. We get to know them really well. So that's one of the nice things.
How does gynecologic cancers affect fertility of women?
So it depends on the cancer. Ovarian cancer can be, if it's early, can be diagnosed and treated and not necessarily, it may delay fertility a little bit, but it won't necessarily compromise fertility. Endometrial cancer, for women that still desire fertility, they're treated hormonally, which is a slightly different way. And that, again, would delay fertility. The same process by which the young woman might have had endometrial cancer might also be interfering with her fertility as well. So that can be an issue. Cervical cancer, if it's early, can be treated in ways that don't necessarily impinge on fertility. Later on, it would not be possible to be treated for, say, an advanced cervical cancer and preserve fertility unless you worked with a reproductive endocrinologist before you started treatment. And actually, for all patients with cancers and also GYN cancers, if fertility is part of the important part of decision making, it's really important that they meet with an oncofertility expert to discuss that sooner, like before, not after.
What does being BRCA gene positive mean?
So interesting, because everybody has a BRCA gene. Everybody has one. So being positive, what people generally referring to is having a mutation that causes a problem in function with the BRCA gene. And this is a mutation that you can get, a gene that you can get, same as, what determines your eyes or your hair or anything like that. You can get a BRCA gene that either sort of works or does not work. So the ones that do not work well are the ones that I think are associated with being BRCA gene positive.
What disparities exist in gynecological cancer diagnoses and care?
Well, access to care is a really big issue, and we do have data that women with gynecologic cancers that are treated in sort of tertiary care hospitals, places where they take care of more patients like this, will do better. So it's really access to care. In some places in New York City, most people have that. There are gynecologic oncologists literally everywhere, but in other parts of the country, they're not as readily available, and that's an issue. Sometimes it's again availability of appointments, availability of doctors, availability of proper care. These are all things that are an issue.
What is the first thing you tell a recently diagnosed patient that has a gynecological cancer?
Well, I can when I see a patient with a new diagnosis of a gynecologic cancer, I know that she is, she doesn't want to be there at all seeing me, and I know she's pretty anxious. So what I usually tell people is just to stop and breathe, and we can take care of this, because we do know how to address a lot of different things. And people hear cancer again, and they don't hear anything else, but we can really, the treatment for all these diseases actually move forward a lot, and we can really help a lot of women. So I think what I would tell a woman with a newly diagnosed gynecologic cancer is like, okay, take a deep breath and let's move forward.